Well, your face away from the mic when you do that.
Okay.
Yuck. Oh.
Hold on. Okay, I'm done.
Are you done?
Yes.
Hello, listeners. Thanks for tuning in again. Today's guest is somebody that early on in our relationship, we both connected on mental health. And since then, it's been something that's wildly important to both of us, so much so that she has dedicated her career to helping others with mental health issues. So please welcome today's guest and also my wife, Kim Duke.
Hello.
Hi, Kim Duke.
Hey, Chris Duke.
Now, what made you want to start working in the mental health field?
I think my own depression and anxiety and not understanding it and not feeling like I was being heard. When I was really young, I had stomach ulcers. I had a lot of stomach problems, and a lot of it stemmed from anxiety.
Do you know how that works? How that relationship between like ulcers and anxiety?
No, it's the acid in my stomach. I was constantly worried. So something about this, I don't know.
You know what I mean? I've never even thought to look into that, but
yeah. So something about that, and it happened a lot around when my parents were having problems in their relationship. And so then, like, I complained a lot about my stomach. And then depression came on after my anxiety. And then obviously situational things happen, and then lots of thoughts of not wanting to be alive. So I was still trying to figure out that. And then that's when I thought maybe I do want to work in this field. I just didn't know what I wanted to do in it. So I thought about being a psychologist. I thought about being a psychiatrist. And then...
well, I thought there was an individual that you had met.
Yes, that's where I'm getting.
Oh, sorry.
So then... so I thought about those things prior to the event that led to me into the area I went to. I kind of thought about nursing a little bit because I was a nursing assistant, and then I had a suicide attempt. I wasn't hospitalized after my first suicide attempt, and then I continuously had thoughts, and I had a plan. My mom took me to the doctor. I got admitted, and it was a surreal feeling. And then I couldn't sleep, and this nurse sat and talked to me all night long, and didn't talk to me like, you're a patient, I'm a nurse. Just like sat down and had a real conversation with me, because we didn't talk about mental health at my house. It was everywhere in my house. Everyone struggled with something, but we didn't talk about it. So I felt like I was losing my mind. I couldn't understand all these feelings I was feeling all the time. And this nurse just sat with me, honestly, all night long. I don't even know if I slept. It just made me feel like I'm a person.
Yeah.
The things I was feeling, I'm not the only person who feels these things. And what was crazy is being on that inpatient unit, I was with all these kids who essentially none of their parents or anyone wanted anything to do with them. My mom was the only parent that came and visited the whole time I was there. But so that night I talked to that nurse, and the next day the psychiatrist met with me, and we were talking, and he was trying to gather why, like what led me to be there, all that. And then he said something, and it just like something switched in my head, and I was like, all right, this is where I'm going to work.
Oh,
I'm going to work in this field. Well, he said something very profound, and it's silly to think of now, but he just as a teenager, you have tunnel vision and you can't see anything past this tunnel vision. And he said, did you know that when you're dead forever? And essentially, I didn't want to die. I just wanted all these feelings to stop. And I thought that was the way to get it to stop. But I forgot that after that, there was nothing left if I stopped that. And like, I cared a lot about my younger brother and trying to protect him and all these things that it's like, I just wanted these feelings to stop. So when he said that, you know, we had a really good conversation. My mom came and picked me up. And that was when I was like, all right, I'm going to be a mental health nurse.
Yeah. I mean, that's a lot like when people say they just want to silence the noise.
Yeah.
Yeah. It is a crazy thing to think about. You'd mentioned that, that there were parents that didn't really want to come and see their kids in this situation. Did you find that common when you were working with youth and adolescents?
Yes and no. There were just some kids that essentially get put in, I don't know what happens with their, you know, obviously they're taken away from their biological parents for whatever reason, and they get put into foster homes.
Okay.
And I think a lot of times, obviously there's this trauma that happens as a child, which is what leads you to get taken out of your home. Then you don't know how to cope with things like healthy. So these kids have behaviors because they don't know how to cope with all these feelings that they have. And then these foster families, I mean, some of them are really great. I'm not downing on foster families, but some families don't know how to manage those behaviors. And then they end up in, you know, inpatient units, and they're kind of there, and they don't get visitors. And it is sad. It reminds me a lot of when I worked in the nursing home on like memory care units, and how they almost get forgotten because they don't remember their family members. So I don't know if family members feel like they don't need to visit because grandma doesn't remember who I am anyway.
Yeah.
It's like these kids, it's like, yeah, I was a foster parent to them for 3 months, but really I didn't mean anything to them. It's like,
Oh, I see what you're saying.
you know,
With when you're, you know, Alzheimer's and dementia and stuff like that, I feel like it also hurts.
yeah.
That, you know, you can't really do anything to
Yeah.
change the situation. So I wonder if that's part of it too, is like they feel like they've already given up and they've kind of failed this kid, and maybe it hurts to go and see them.
And I'm not trying to judge that situation at all. I can't even imagine. But it's being a worker, working with those kids, it's also sad because you do, like, I did feel guilty when my mom came to visit me, and she came and sat with me for hours, and you look around and not a single other kid that was on the unit with me had a visitor.
Yeah.
And it's like, I'm not any more special than any of these other kids.
Oh yeah. I mean, yeah, that is a weird feeling, but that's an interesting point because like there are people that feel like the burden that they were trying to alleviate by ending their life, now they're feeling a different kind of burden. But really, you should be, and like you were saying, like looking around and being like, oh, it's like it's not fair to these other people, or because I had a little bit of that when, you know, especially at the treatment center, like there were people that, you know, we had to walk that hallway, and there were people that would just always stay on our wing because they knew nobody was coming, and not that you have to rub it in these people's faces, but acknowledging and like embracing that support group, rather than like kind of retreating and being more reserved. Like really, like that's a good first step, is to be like, I accept that I have this really delicate thing, because not everybody has it.
Yeah.
And something I say on here all the time is like how insanely lucky having like 18 people on deck just ready to help out is not always the case.
And I think I have that in me because as complicated as my mom and my relationship has been growing up, she was always that one person that was there, you know?
Right.
I didn't call her and ask her to come visit me. She figured out when visiting time was, and she just came. when I was waiting to get admitted to the unit, we sat in the yard together for hours and hours, and she was just there. It was never that's just what she did. So in my life, that's just what I do for people that I care about or I love. It's like visiting you twice a week at the treatment center wasn't a big deal. It was like, yeah, that's just what we do. That's
Right.
part of our day now. Or like when you were on the inpatient unit, it was like we visited twice a day because that's what we do. Now we make that a part of our day because that's important to us.
But I don't know. There's people that, like you were saying, like maybe they make it for a little bit, but then, they think that what more do they have to offer beyond just showing up, not realizing that showing up is a huge part of it.
Just the presence of somebody. It's not like we always showed up and we would talk about your treatment or what you like when you were in the inpatient unit. We didn't always sit there and be like, oh, what did you learn today about your mental health? We were just there.
Yeah.
We were just talked about our days.
Talked about our days or just random whatevers. And not that you have to talk either. Yeah. I get that there's people that are, not big talkers. So just sitting there, I don't know, with a deck of cards or something, like it doesn't always have to be a profound thing when somebody comes in.
Yeah.
I think is another thing. Because I think people do feel that pressure, like that when I go in today, I'm going to say something that's going to turn it all around for them.
Yeah.
And
that might not always be the case.
Yeah.
Yeah.
I mean, I think that's another underlooked thing when it comes to mental health. I mean, like, correct me if I'm wrong, but the thought that as soon as they leave the hospital, everything's all better. We took care of the thing.
No.
But
if you say someone gets hospitalized with a heart attack.
No, I'm saying.
Oh. But people feel
Yeah. People feeling that way.
Like patients or families?
Families.
I think, yeah. I think mental health's a hard thing for people to understand because there's no blood test. You can't start a medication and take a blood test and know it's getting better. Like with blood pressure medication, you take a medication, check your blood pressure, and you can tell that it's working. I think it's really hard for people to understand that some meds take time, and there's not, like, meds aren't always just the answer. Like, there's other things, therapy and all that. I think it's just hard for people to wrap around because we live in a society where we're constantly moving so fast that we want the quick fix.
Right.
I mean, we see all the time plastic surgeries, all this quick fix stuff, and it's like, but mental health, it's not a quick fix.
Well, and usually when somebody leaves the hospital, their surgery's done, their whatever's done, now we get to leave all that shit behind. And if there's stitches or something, like, there's little stuff but that's like an afterthought. It's not a huge deal. The main thing is all done now. So, like, people think that just like that the person's going to remember their time in there and be like, oh, I don't want to go back there again. But really it's
providing a safe environment for the time being until they can figure things out, what's going to help out the patient, just getting that immediate crisis settled and figuring out what other things we can provide for your next transition.
Do you remember starting, because what was the first like mental health job you had?
Probably when I worked in the nursing home. I mean, it was a memory care unit, but that's kind of can be mental healthy. It was probably
But I mean, your strategy is all mental health versus when you're in the nursing home, you're like changing out shit and
like straight mental health.
Yeah.
Probably when I was that behavioral health aide while I was in nursing school.
Oh, I forgot about that.
Yeah.
Yeah, because you had like a couple of kids, right?
Yep, I worked with kids, and I had a treatment plan that a social work therapist would put together, and I would have to go into the home and work on things with these kiddos.
Okay, so it was like a checklist that you're...
Yeah, they had goals. They had treatment goals.
Is that what an IEP is?
No, an IEP is a school thing.
Oh, okay.
No, it was just like a treatment plan.
Okay.
And I go in and say, for example, like a kid had issues with anger. So my goal would be to go in and play a game with this kid and not necessarily let them win and make them angry, and then to work on the skills to make them not angry anymore.
Interesting.
So it was a lot of play therapy, and I'm not a therapist, but I was an aid to I was given tools, and I go into the home, work on whatever their thing was. A lot of it was anger, emotions, regulating emotions, and then use the tools in my bucket to try and regulate those emotions.
Okay. I mean, so maybe that's not the best example, but maybe, when it comes to like, do you recall what you thought mental health work was going to be like versus what it, like how you actually operate? Does that make sense? Like when you're going through school, you're imagining I'm going to go and make a difference and change things. And like when you actually got, boots on the ground, do you remember like being shook about how different it was than I'm wording it in kind of a weird way, but.
And then I did my clinicals at the NOCA Treatment Center, which is a little different. That's a longer term, like how placement. A lot of times there's people from jails or all that. They're really ill. They're really mentally ill in these longer term facilities. So that was so then I had this kiddo situation, and then I had this adult situation, and I was like, I think I want to work with kiddos because I feel like you can intervene earlier. So I was like, great, this is going to be awesome. I'm going to be a mental health nurse in child and adolescents, and I'm going to make a huge difference because I'm going to be in there and intervene early. And I think kids are harder because it's sad.
Oh, yeah.
Because there are things that you can't fix. Home situations. I can't fix any of that, which is hard. And that tunnel vision. It's so hard to get kids to see past this. And I remember, because I was that kid too. So I thought, I've been there before. I saw like this. I'm going to be able to get to these kids. But you also can't share anything personal about yourself.
Right.
So you have to develop appropriate boundaries. So how do I get to these kids when they think I'm just this jerk who went to school to be a nurse and I don't really care about them, but when in reality I have that lived experience, but I can't share that because it's not appropriate. It's not therapeutic to share your lived experience with especially kids.
Oh, with kids, sure.
So when I got my foot down, I was that new nurse, fresh out of school. I'm going to make this big difference. And it was like a kick in the face, because it was just like things that you could not fix. And that was tough. You would see kids get better. Mm-hmm. You would get letters when kids would leave and how they improved. But then you deal with kids that don't make it. And that's tough because you go back to when you were that kid. And that one psychiatrist told you that thing that made you see that end of the tunnel and like, no, I have things I want to live for. And then, when you took care of a kid, they left and then they ended their life by suicide. It's like, what if I could have said the one thing that was helpful? What if I did share my story and that was it? But then it's like that. You can't, it's hard because yeah. And you see movies and you're like, oh, maybe it'll be, yeah.
Yeah. That's one thing that I noticed. And, when people would say like, I should go into counseling or I should do XYZ, like I can't deal with like the concept of like when it's okay or like just it's not okay to like completely open yourself up to a person.
Yeah.
Because that's my like I've done it.
But that's the codependency in you too.
Yeah, for sure. But I also I've never gotten somebody to open up by just like doing surface level stuff. You know what I mean?
So that's a skill I definitely learned. And you have to learn it quick. Because walking up to a kid and being like, hey, what would you rate your suicidal thoughts at today? 0 meaning none, 10 meaning like they won't stop. it's like having to have that conversation. Thankfully, I have children.
So you're saying like tone and body language?
Yeah, but it's like I wouldn't walk and start the conversation with that. I'd be like, hey, my name's Kim. I'm your nurse today. How's it going? And try and get to a music. Music's always been my thing. I always ask kids about music, and I don't know a lot of the music, but then there were kids that would kind of listen to the same genre I would. So we could kind of get on a level where I'm like, oh, do you like going to concerts? And then once you build that rapport, I'm also not sharing anything personal about myself. Don't really share like my favorite band of all time is this. This is the kind of music that I think sounds good. What kind of music do you like? Oh, and then it's like once you break that barrier of I'm a human, you're a human, then they're more apt to be like, yeah, this is kind of how I'm feeling today. Okay. And they see you as a person and not just this person walking around asking these same questions over and over and like you don't care, like they're just a number. That makes sense. That was a really long answer.
No, that's yeah. I see like kind of the reason that I do it is, or that I do it my way is because my thought process is probably like, I want this person to feel like they have a friend.
Yeah.
Versus what you're doing, which is,
I just want to be a person, not necessarily
so somebody
a friend.
who's of use and is going to be there to help them.
Yeah.
I gotcha. Yeah, that makes sense. And that makes sense towards my codependency brain is the fact that when I say I don't want this person to feel alone, I want them to connect with me on a personal level quickly because I need them to know that like I'm on their team.
Yeah.
And so, yeah, even though there's people that I'm not gonna, might not ever meet again, but like, it's always I've gotten so used to it now doing it that way.
Yeah.
But yeah, it makes total sense as to why it is that my brain thinks that way. It's very good, Kim Duke. Look at you mental healthing me while I'm
always mental healthing. Yeah.
So when you were working with kids, I mean, was it traumatic?
Oh yeah.
Having to work through that stuff?
Yeah. Because you hear awful stories and then you're a mandated reporter and things happen with that where you have to report things. It's just sad to know that these kids, I watch true crime stuff. I'm obsessed with that. I listen to these horrific stories, but then you meet it in real life and you're like, how can this happen to this child? And I think what was the hardest was coming home and having kids, because I love the crap out of these kids and I could not imagine them having that, like these experiences that these other kids had. And so that was probably the hardest thing, is just the stories you would hear and knowing it's happening in real life. I'm not watching a show where it does happen in real life somewhere else, but I can separate myself from it. But then you're sitting with that child and you hear these things and you're like, no, these children we're supposed to be as adults, we're supposed to be fostering and caring and providing for these children. And I mean, there's situations that happen where they're not getting that, and that's tough because I'm a fixer. I want to fix things. And when you can't fix things, then you feel defeated. And it was a lot of going home feeling like, I don't think I made a difference today.
Well, yeah, I would imagine you hit dead ends because in instances where you do want to go the extra mile, I'm sure you have to hand things off. Like, I'm sure there's things that a social worker is supposed to do that you're not supposed to do. And
yeah.
So that whole, like, there's like red tape where that's gotta suck.
Yeah. Like and I'm not saying that working in child and adolescence is the worst thing ever. I loved it. I still love kids. I still love working with kids too. It's just a different type of hard than adults are, and I still have passion in both areas. I still love working with kids. It's just like having to learn to work with them without taking that home I learned that real quick, but it's hard as a parent, I think too. And being a nurturer and being a nurse are like you go to nursing school, you're like, I'm going to make a difference. I'm going to help these people. And then it's just hard when it's like, it's not like a quick, you make a difference. Like you're with these kids for a few days and you finally start making improvements. Sometimes not, sometimes they're there a little longer. And it's just like learning how to work with that. When all my clinicals, besides my psych rotation, all my clinicals is like, oh, I was on a med surg unit and I did all these things and great, that person's going to go home tomorrow. Not that I made the difference. It's medications and all these other therapeutic things, but I provided those medications, you know?
Well, yeah. I think with working with adults too, you're not necessarily relying on the parent to be a good person.
Yeah.
Like with the kids, you do have to, you know, you have to give them back to their parents or back to their foster parents and be like, please be good people.
Yeah. And I'm not saying, and I know it sounds bad because now it seems like I'm dogging on all these. I've had, I had kids that had like mine. I mean, I didn't have the greatest home life either, but it wasn't bad, but I still struggle with anxiety and depression. You know,
what I was meaning to say was that's not implying that they're all bad parents. Yeah. It's just that's out of your hands.
Yeah.
Whereas when you're working with adults, it's like you're not playing telephone. This is the main person.
Yep.
In most
and
instances,
the responsibility
probably,
with adults relies really on them.
Right. Yeah.
And the trauma that they've experienced, they can talk about now and kind of process, whereas kids don't look at their traumas the same way.
I mean, like, are there, like there's adult support groups and stuff. Are there?
They do group therapies for kids. Yeah.
Outside of the mental health facilities?
Oh, yeah.
Oh, okay.
Yeah, like day treatments. They do day treatments and stuff like that for kids. So that's helpful. I'm sure that's helpful. We had day treatments and partial programs.
I'm saying, like, but can any kid just walk in and go to that, though?
I mean, referrals and
that's
all that.
That's what I'm saying is, like, for adults, like, they can just make their own little groups, or
that's
a volunteer can, support groups for, veterans or like stuff like that. Like, people can just make that group, whereas kids can't really do that.
Yeah, they can't make appointment. Yeah.
They also don't have there are survival tools that I feel like help in understanding certain things, going through having a job, going through raising kids. There's certain things in your life that even if you don't have a grasp on mental health, there are parallels that you can compare things to, and your understanding of, like, oh, that's why I didn't want to go to work that day. And it's, that like
now I can tell, like, oh, I'm getting really anxious because I know this is about to happen. Like, as a kid with all my stomach problems, it just was there. And I thought, like, I couldn't figure it out. But now as an adult, like, when I'm not feeling good, it's because I know, like, I'm really anxious or overwhelmed about something. And it's kind of honestly eating my insides out because I'm so stressed.
Yeah.
But as a child, you don't understand that all those big emotions. I use that wording a lot when I worked with kids.
Big emotions?
Big emotions. You're feeling all these big emotions inside that you can't figure out, and it's hard for you. Kids have a really hard time identifying anxiety. So I used the word worry a lot. You feel a lot of worry. But as an adult, I can know that. I can identify, this is my anxiety kicking in.
Yeah, I mean, people that don't have anxiety say this gives me anxiety.
Yeah.
Yeah. Speaking of, like, people using different terms that don't actually apply to them, why do you think people say I'm going manic, or I had a manic episode, just because they bought, like, a nice bike, or, like, you know what I mean? Like, we hear people say that I'm going manic, but they don't actually have any diagnosis.
Just a term that people, they hear and they use it as they don't understand it. They don't understand what true mania is. I think if this whole breaking that stigma, if we talked about what true mania is, I don't think people would say, oh, I'm manic right now. Because true mania is, people get hospitalized for that. They're spending lots of money. They're putting themselves in risky situations. They're not sleeping. It's not that they don't want to sleep. They don't have the desire to sleep. So they stay up and they pace and they're, hyperverbal, and everyone's mania looks a little different. But I think people feel when they have that high and people can just have that euphoria. You can feel euphoric, but mania is not just like I was feeling like really euphoric, so I went and bought this.
Oh, yeah.
Mania is like, they're like that, and they're going and buying multiple things, and then they're putting themselves in situations they necessarily shouldn't, or...
Well, and I don't think that they understand, like, they assume that, like, these people, like we just feel happy for a day, and then that's it.
Yeah. And
they don't realize that there's a swing coming.
Yeah. It's a crash.
Do you remember what is that process of, because your brain creates, what is it, serotonin and endorphins?
Well, you have dopamine too.
Dopamine. So if you get an influx of that, there's something in your biology that tries to balance that out.
Yeah.
To bring it back to like an even keel. Do you know?
I can't remember exactly But then, yeah, people have that crash where they're depressed and they don't get out of bed for days. But people use I'm bipolar because they have, the alternating moods where they're feeling happy today and sad tomorrow. But that's mood change, is not necessarily bipolar, like true bipolar. I mean, you do have those mood swings, but they're very high or very low.
Yeah.
But I think it's just terminology that people have learned, so then they just use it without understanding I don't think they mean it in hurtful ways. It's just the lack of understanding.
Yeah. Yeah. Working in because you've worked in a few different types of...
So I worked inpatient, child and adolescent, and then I worked outpatient with adults with severe persistent mental illnesses, and then did assessments in emergency room, and now I'm a mid-unit type of nurse. Yeah. So yeah, 4 different settings.
And I was going to say, so of those settings, it seemed like you were always kind of gravitating more towards the
crisis,
the front line. Yeah. The crisis side of things. Because even when you were doing the other stuff, I felt like I was always hearing you talk about how you needed to know the beginning stuff, and people weren't properly giving all the information as to why they came in and what happened when they came in and stuff like that. So it seemed like that information seemed to be the most important to you because that's where you're going to get the most, I would imagine.
Yeah. The presenting factors. Yeah. I thrive in crisis. I think my life has been crisis. So my entire life has been crisis. Always something happening and having to figure things out and try and get to my baseline during a crisis situation. So I think that's why in work I thrive in crisis situations, because that's where my body's used to living. So I think that's why I like working with that, because I feel like this is where I feel even. Okay. I don't know if that makes sense.
No, yeah, it makes sense. It's just an interesting place to live, to be to be aware of the fact that you have, anxiety and can have panic attacks and things. But at the same time, this is the place you want to live.
I know.
You know what I mean?
So messed up.
But I feel like
it's like a comfort, because I don't know. When I worked in the clinic, I was bored. And it's not, I loved the patients I worked with. I loved the setting. I was bored. These patients were not necessarily where they needed to be. We were focusing on their medical cares and not so much their mental health, but we set them up with mental health providers and all that if they needed it. I was just like, these people aren't in crisis. They have all these things set up and we're helping them set up, but they weren't in that setting where they needed more, way more. But But then it's like when I went to the emergency room, it was like you're in that crisis situation and you have to figure things out quick. And that's where I thrive, is like trying to figure things out quickly. And what resources can I give this person in this amount of time?
It makes sense why you like math, because
you have to think quick.
Yeah, you have to think quickly, or, I mean, it's assumed that you've got 1, 2, 3, or like step 1, step 2, step 3, and then you've got your thing.
Yeah.
And in problem solving with life, it's not always that cut and dry. Yeah. But I would imagine in those crisis situations, you do kind of have, what's the word I'm looking for? You have like a time limit as to like the first, or critical. You have like a critical time frame of things that need to be figured out and understood. And because you only get them, like, how long would somebody be in the ER for?
It really depends. That's a tough question, because there's a lot of factors that go into why someone's there for a period of time.
If somebody came in for nonviolent mental health, and they don't necessarily seem like they're in immediate danger to themselves or anybody else, would you get the same amount of time with them?
Yeah. Yeah. I mean, I tried to spend as much time with everybody as I could, but there's different factors that go into each of those people. I'm thinking what kind of resources do each of these people need? If they're a danger to themselves or others, they're likely going to need inpatient mental health if we can't, if they're unable to remain safe or keep other people safe. That's easy. Those ones that are not necessarily in immediate danger, where are they at? Is their anxiety is unmanageable? Is their depression out of control, where they're not getting out of bed, they're not eating anymore, they're not showering, they're not taking care of themselves? But there's just so many factors. So trying to spend as much time with them to get everything answered, where I can come up with a plan with the provider that is what's going to help that patient.
When family members were present, did that seem more of a help, or did that make things more difficult?
Both. I've had difficult family members. I've had family members that provided that right amount of information where it made a difference in that plan of care. Because you would see patients that are not necessarily telling the whole story. They just had a loaded gun at home, and now their significant others here telling us, I just had to have the loaded gun taken out of the house. I didn't know about that gun. So-and-so didn't tell me about that. Stuff like that, where there's the lethal means that someone else brings up that, that person didn't necessarily tell you about. But then you also have family members where this person, or I've had a lot of he said, she said things happen where it's like, none of that happened was true, but this person was telling me all these lies to try and get this person hospitalized. So but the thing is that collateral information can be the deciding factor.
What is
the collateral? So the information from, another person, a loved one or friend or family or whatever, that can make that can be a turning point in this person's care. But sometimes it's like they can be difficult dealing with.
Well, yeah, so that's what I was curious about, is if like the majority of the time, or I shouldn't say majority of the time, but did you see more of
it helpful
a hinder than it was helpful?
No. It's hard to say. It's like 50-50.
Okay.
Most of the time it was helpful. I think people truly care about other people, and they would tell the truth or tell you things that someone was hiding.
So what are the key things that a family member could bring to the table, like in a perfect world? Like if you had a family member come in and you were to say, I need to know these things, do you know the answer? You know what I mean? Like,
yeah. What's been going on? Have you noticed a change in their behaviors over the past couple months? Lethal means like what in the home do they have access to medications? What has been helpful for them in the past? Have they been hospitalized before in the past? Those type of things are the questions I like to ask. Because changes in the behavior is a huge thing, especially someone that you live with when you notice those changes. And a past history of suicide attempts is huge too. And even if we're not talking about suicide, even just changes in behavior overall.
Adjustments in routine and stuff like that.
Yeah.
Yeah, I was curious about that because I know, I mean, like doctors and things like that, they want to know like 2 or 3 things and everything else is just oversharing. And
I don't think I ever felt like someone was oversharing.
And that's what's interesting is like in mental health, it's not necessarily that
I get what you're saying
yeah.
though. Like when I brought my mom to the ER for things and it's like they just want to know these 2 things, but it's like I feel like all these other things are just as important as those 2 things and you're not listening to me say all these other things. I get it. You know,
and that's what I was going to say was interesting is like in the mental health field, like more information typically is better.
Yeah. How are you eating? How are you sleeping? You know, have you lost interest in things that, they stopped playing in, you know, band. They stopped, you know, they used to really like to do this one activity. Now they quit for no reason, or they quit their job that they really liked. Like there's so many things that you're like, are kind of warning signs to me that kind of stick up, but they're not just 2 things. It could be multiple things.
So when somebody leaves a mental health facility
Mm-hmm.
and or let me bring that back. So somebody goes to the ER, they meet the criteria and you have the availability to bed them on the adult mental health unit or the children's unit. Are you checking in on that at all?
There have been cases that have been interesting where I'll follow up with the psychiatrist later, like when I run into them and ask them like, hey, how was so-and-so and all that while they were on the unit. But no, because there's like that HIPAA. So I can't just go into someone's chart even. Like I
was just curious because I didn't know if so it's not a part of your job description.
No.
To be, okay.
No.
So is the psychiatrist really like the only person that kind of gets that full 360, like, do we have this like XYZ or do social workers?
Yeah, the psychotherapists, the staff, all the staff know the patient's story and kind of what brings them in, and they're all a part of the treatment team.
Okay.
Yeah.
So what you see is they did go to this unit. Mm-hmm. They did. Okay.
Yep. Yeah.
Okay. So what?
Where that's hard too, because it's like, then you don't see the outcome.
Right.
So that was like, it went from, I worked in the situation, worked in the inpatient unit where we got them after immediate crisis. So immediate crisis happens in the ER, we get them, and then we get them to their next step, which it could be home, a residential facility, all that. So I got to see a little bit of an outcome. Then I went to the clinic where it was, okay. Then I went to the ER where it was like, yep, crisis. And then it was like, don't know. I hope they're doing well. I hope that their stay wherever they went well. Or when I sent them home with that appointment, they showed up and they're doing okay. It's a lot of that. But you don't get to see that end result all the time. So one thing that I did after you left is I've reached out to those providers. I reached out to the psychiatric provider that you worked with, and I reached out to the chemical dependency.
What? You talked to my...
I know. And I reached out to the chemical dependency counselor that you met with and just let them know how well you're doing, because mental health is so hard because you never know how people are doing. You only hear the bad things.
Right.
And that sucks. It's like we're constantly surrounded by the bad things. It's like, but I would remember when I would work inpatient, when we would get a letter from a kid months later and they were telling you how well they're doing and all this, like that was what kept me going. That one letter every couple months was like, all right, I am making a difference. It doesn't feel like it every day. So that's why I felt like it was important to share that, because we don't hear it enough. We hope it's happening. Mental health is so hard.
Yeah. I guess so. Yeah, that's kind of what I've been curious about. And maybe that's another aspect of the codependent side of me to think about, like, because I always try in every job that I've ever had, when somebody starts to talk about the customers or the patients or whatever, talk about them as though it's like a chore or like an aspect of like, can you go mop the floor? Shouldn't have the same tone as, can you go check on room 20, whatever.
Yeah.
You know what I mean? So like my brain latches onto that in making sure that these people, that you never forget that that's a human being. Yeah. And that they're going off to continue to be a human being after this. So maybe that's why I am so curious about the, like, who has eyes on the person to see.
I think, and I'm not saying this just because of where I think I am blessed with the people I've always worked with.
Are you #blessed?
#blessed.
Oh my God.
I think I have always been surrounded with people who are so passionate about mental health. I was worried when I went into mental health, because you can get hired in it pretty easily, because a lot of people are afraid to work in mental health. However, it's everywhere you go. It's on every unit you work on. It is there. 1 in 4 people have a mental health diagnosis, you know? So working in it, I'm like, okay, it's going to be all these new nurses getting out of nursing school, just wanting to get that 6 months of experience, and then they're going to move on. Everywhere I've worked, the people I've worked with are so passionate about mental health, because, and obviously we don't share the stories with the patients, but amongst each other, we talk about our stories, our experiences, our family experiences. You know, I think that lived experience that we've all had puts our passion into mental health, and that makes, like, we don't look at patients like a number. Like, yep, I'm going to go check on room 19 right now. It was like, I'm going to go check on so-and-so. Everyone had a name.
There you go. Yeah, that's what I was getting to, is like, yeah, and I get that it can be, because it's so draining sometimes, like, because you're not getting the results you want, or they're not making the progress that you wish they did. It can start to wear you down. And so you do start to go, all right, well, we got to change the garbage cans. We got to, that whole thing.
And I felt like in the nursing home too, it was different, because it was like, yep, we got to go do this in this room. We got to, you were moving room to room to room to room, and all the residents had names. We knew them because we had them for a long time.
Oh, sure.
But it became like that chore, like, oh, yep. Whereas it didn't feel that way coming into mental health.
Are there any like instances that you remember working in a nursing home that helped you in what you do now?
Patients. Just being a patient person. Yeah.
Oh, patients
like,
in general.
Just being patient. Yeah. Because especially working memory care, like, you have to have patience with those residents. And I think that was what kind of framed me in having patients now. You're listening to these psychotic patients just rambling about things that make no sense. But my dementia patients also talk about cows under the bed, and they're going to go milk these cows, which is not real. But this person's delusions of the government spying on them is so real to them. And this resident's cows being under the bed is so real to them. You don't tell them that it's not real. You listen. You actively listen. And you don't, you try and you don't argue. You just listen and be there. Be present. I think that's one thing I learned too. I'm not trying to compare the diagnoses because they're different, but however, in their world, that is so real to them.
Right. I was going to say the sentiment is that it doesn't matter if it's real or not, because in that moment, their behavior is showing that it is real.
Yeah.
At least in this little chunk of time, it's real. It's happening in their mind. Because if something, dreams and nightmares aren't really happening, but when you're in them, you can't tell the difference.
Yeah. I think another thing too, and I didn't talk about this earlier, is what helped too is when I was trying to figure myself out, I read a lot of memoirs of people with mental health, lots of family members of people who lost somebody, or family members or people themselves writing these memoirs about their mental health. I read tons of books about mental health to try and understand like the family side of things and then the patient side of things. So I could understand the whole, I mean, I was a patient for a brief period of time, so I kind of understood that, but wanted to understand like the family side, because my mom, like trying to feel how my mom felt when I was locked away from her, trying to get all that. So just learning as much as I could about all these different diagnoses, and then putting myself into school and trying to learn even more about it.
Yeah, I mean, that made me think of like, there's got to be a book of somebody with early onset dementia being like, I'm going to document where the as much as I can until I can't anymore. And it'd be interesting to see what that, if they're like, when I can't do this anymore, I need you to kind of show people what was going on. Yeah. It's an interesting thought. I mean, and dementia and Alzheimer's is another one, like we were talking about with bipolar and stuff. People not understanding, like thinking that it's just a forgetful thing, but it's forgetfulness to the point to where you're wetting yourself, to the point to where you don't know how to get home anymore.
You can't put your clothes on anymore. Sometimes you can't stand. There's just like normal activities of daily living you don't know how to do anymore. You can't put your shoes on anymore. You can't. Like, you just forget all these things. And it's sad. Like, yeah, they're forgetting family members, but then, you forget how to go to the bathroom. You forget how to walk.
Yeah. Yeah.
It's a debilitating disease, and it's awful.
Yeah. The stuff that people find, like, endearing or quirky is just...
Yeah, the cows into the bed thing. I go back to that.
But, I mean, when they think about it, like, that's the beginning of the end of, like, a pretty... horrible way to go. So it's so weird to think about, like, because obviously I have like a darker sense of humor and I laugh at things that are messed up, but but it's also with the understanding of what that situation actually is.
Yeah. Well, especially people who work in mental health, we have pretty dark humor because that's how we survive. We have to have some type of humor to be able to like go home at night and be like, okay, I'm going to come back tomorrow. And
well, I think that dark humor among coworkers is really just a way of saying that was fucked up, wasn't it? And then the other person, laughing or agreeing, like it's just like a really,
it's how we cope.
Yeah. It's a fun way of being like, can't believe we had to do that, or that we got out of, you know what I mean? Mm-hmm. Like, I think there's, yeah. I mean, it's been like that for ages and ages and ages. Like people who go through or are associated with like traumatic things, if you don't find a way to incorporate some type of humor, like whether it's inside stuff like with you and your coworkers, or maybe on a broad scale, but if you don't find some way to do that, then it just sits, and any time that it comes up, it becomes more negative. And so no matter how much you try to bury it down, there's always going to be some random thing that you never think of that would come up and then make all that crap resurface.
And a lot of like my coworkers, we have different experience working mental health. Some people obviously came from different facilities, and we like to talk about like the experiences we had. And we do a lot of like, holy crap, how did you survive? Like, but it's learning experiences, and we share it with like newer, like these are things that we've learned from these experiences to try and provide the best care.
It also is actually a good way of like not feeling like you're alone in that struggle. Like you're genuinely being like, that happened to you, this happened to me. So whatever we're going to do next, we know that, we got each other's back. Yeah, for sure. Your understanding of trauma bonding, is it a negative thing?
It can be. Oh yeah.
So for people who don't know, how would you describe what trauma bonding is? Because the dark humor thing is like almost like bordering. Yeah. I would say, right?
I think like early our relationship, we trauma bonded over our past crap relationships, and it wasn't healthy. The way we trauma bonded, we're like, yeah, I experienced this.
all of my relationships are healthy, so I don't know what.
Oh, okay. And then you would talk about yours, and we're like, and then we also did not have a very healthy relationship,
right?
Because it was formed on unhealthy past relationship bonding.
Okay. So it's finding that common ground without any like intention of making things better.
Yeah.
So it's I got you. So if you are going to do that, like if you find
it's okay to share experience, and obviously there are people that are going to have similar experiences to you, but then like that relying on that other person to make you feel better about that situation, knowing that they already went through it, that bonding part with the trauma, it can be an unhealthy relationship in itself.
Yeah. Well, I mean, that whole, like, you're the only person that would
understand because you went through it too. And everyone's lived experience is different.
Yeah.
Like my anxiety is not the same as that person's anxiety. You know, that person, I can function with high anxiety. I do it every day. Like when I fill out my anxiety questionnaire and then I go to my annual physical and I have to tell my provider, like, I'm fine. Doesn't look good on paper, but I function like this. This is my baseline. But Joe next door, if he was at my anxiety level, he'd be in the hospital.
Yeah. It's interesting. Yeah. Medication. Wow. It's such a tough thing. I mean, we have so many people. I say we, obviously our we's are very different, but we hear it all the time, which is, I'm getting off my meds soon because I don't feel like myself.
Yeah.
And it seems like in most cases that person isn't doing therapy, isn't doing anything beyond taking the meds. Mm-hmm. Why do you think that?
Because we live in a world where we want the quick fix. Therapy takes time. It's an hour a week. Mm-hmm. And a lot of people don't have that time. I mean, now things are more convenient, you know, online things or all that. Now a lot of things are virtual, so you can do it from home. But like if I were to do therapy, I work Monday through Friday, 8 to 5. How am I going to find a therapist after 5 p.m.? So yeah, I'm going to take meds because that's going to be the thing that's going to work quicker. Even though that, you know, obviously takes time. It's hard. I don't know.
Well, what I mean is like, why does it seem like people take meds and they say, I don't feel like myself?
I don't know. That's a good question.
You know what I mean?
I think, but how do you know what yourself is?
Exactly. That's what I was going to say is like, is it really people have gotten so used to the chaos or the panic that they just don't really recall what.
And it's funny you say that because when I'm like even keeled and like super relaxed, then I don't feel like myself. Even though that's probably what like being on anxiety meds would do, is put me back, or then I'd feel uncomfortable and then I wouldn't feel like myself.
You know what? That actually makes one of your habits make more sense. Because rather than just having like a chill day, because I don't say, you know, I relaxed today. I don't say like you know what I mean? Mm-hmm. Like I don't necessarily announce those things, but you'll say, I'm lazy today. I'm this, like if you're not going to do a thing, or if you decided not to do something, for some reason you have to say, like, it's almost like rather than just accepting that I felt better or I felt less anxious sitting down and reading a book. So I read a book. You know what I mean? Like it feels like you're always throwing some type of like mood or something to the thing rather than just relax. It's fine. You don't have to explain anything to anybody.
That's funny you say that because I just read a book the other day, a whole book, and I was done probably by 2:30, and I was like, oh my gosh, I just wasted the whole day. I want to do this, I want to do that, and then it threw me back into this freaking anxiety loop of like, I felt great because could escape my world for just a little bit and just like sit around and do nothing and not worry. And then once that was like that distraction was gone, it was like, holy crap, I just wasted the whole day and I don't have much time and I need to do this and this and this. And then it just, I think that's why, because then I get overly anxious after that. Because I feel like I need to get all these things done all the time.
Yeah. And when you see people not doing those things, your brain is like, how could they, there's 15,000 things to do right now. How could they be so calm and relaxed?
I hate that. Like yesterday, I was so anxious because I'm like, washer and dryer come Thursday. We need to finish the laundry room. We got to get that counter off. I really want to work out. I need to do this. I need to do that. And it's going to get dark soon. And when it gets dark, then I get thrown in a funk because it's Sunday. And it was just like, I started spiraling. It started spiraling at probably about 2, and I could feel it just circling, and it wasn't going to get better. And that's when I started feeling sick and not feeling so good and don't want to do anything.
Well, and I think that's why you pointed out to people too, is the fact, because how do you convey how much real estate this feeling is taking up in your brain? And you guys all look fine.
Yeah.
So doesn't anybody do anything around this house? Yeah. Is really because you're like, how in the world am I going to get all this stuff done? I'm understanding you better now.
Oh, I'm glad. It just took 15, 16 years for you to figure me out.
I'm only 28. Ironically, like that is the perfect mentality in a crisis situation, because you're able to do the checklist, whereas other people don't know what the fuck they're doing and are looking around like, oh, we need a towel. Somebody called 911 on that towel over there. You know what I mean? Whereas because you have your brain, when you get anxious and you feel like the day's been wasted or whatever, you start to see like an actual list and you move through that thing in not necessarily in complete order, but pretty close to complete order, or I should say into your type of order. Like the way that you would start cleaning the house is not the same way that I would start. Like you have a specific way that you like to move through things.
Yeah.
So yeah, in those crisis situations, I would imagine that makes more sense why you thrive in those situations. That's what I'm trying to say.
Well, hell, we figured myself out. Mic drop.
Early on in like when you're going to school and when you're going through things, did you find yourself diagnosing people?
Oh yeah. Even before I went to school. Because I took psychology in high school, and that's when I started reading things about mental health. So I started diagnosing people pretty early. And then I took abnormal psychology. I took that in my associate's degree. And man, I diagnosed everybody. And I think I have I can figure people out pretty well. I legally can't diagnose. I'm not a provider.
Obviously.
But I think I can get a pretty good read on people now after being around a lot of things. You start to know.
Well, it's funny too, like, because, well, I mean, initially it was like my concept of mental health was just depression and anxiety and things like that. And then with being admitted, then I started, because I literally lived with these people who had genuine diagnosis for, X amount of days. And then, so what, I've spent 13 days altogether. So almost a full 2 weeks of time spent on these units. And then in treatment, I was there for 26 days.
Yeah.
And so it's not going to school. It's like sun up, sun down. That's, I'm around it for that whole time. So I like really got immersed in all of that.
Yeah.
And after like getting out of treatment, I noticed that like my sense of what somebody's actual mental issue probably is has become more aligned with yours. Like, there was a situation at the tattoo shop. Somebody was describing the mannerisms and the speech that this person had that was in the day before. And we didn't say it at the same time, but mentally, like, we looked at each other and it was like, dude's bipolar for sure. Or potentially schizophrenic. Or, you know what I mean? Like, you know who I'm talking about? So like, it's interesting now to like kind of see where it's probably leading to.
I think too, it's like it's all my experience, like all of the different people I've been around, like I've got it down to a science where working with adults with persistent.
It's just all day with the Cyber Monday stuff.
I working with adults with severe and persistent mental illness. You know, a lot of them have schizophrenia, and they're middle-aged or even older, and they have it's so hard to describe, but I took care of a patient one time.
Real quick, are you allowed to say this stuff? Like, I don't know where HIPAA starts and ends when you say, I had this experience with a patient.
Yeah, maybe not take it out.
Yeah.
Yeah. But once you've had like experience with certain people, you can diagnose like walking in stores and you see mannerisms and behaviors of people, and you have had this lived experience. You can kind of know what people have going on. It's a different type, and then you have this different type of empathy too.
It's interesting, like it starts to become apparent in the way that they walk or sit, even.
Yes,
which is really
all
weird.
mannerisms. Yes,
is really like if somebody has a is I don't even know how you describe being further on the spectrum, or like is the spectrum a circle? Or like what do you know what I mean? Like,
I don't know. This is so funny. I look at the spectrum like a rainbow. Like, here it goes.
Yeah, right. It's kind
like
of
it's like a
So I mean, depending on where they're at, I like to look at it as like a circle for some reason. So like the further that they get in on this spiral, I feel like that's when you start to notice like they're standing like this, they're sitting like this. And the hand stuff.
Yeah.
Hand stuff.
The tics.
Mm-hmm. But even before that, like I said, like there's this first hint in either the way that they walk or the way that they sit.
They even look.
Yeah, because I mean,
not physical, but like the way they look at you.
The body language.
Yeah.
Yeah. So because I see clients in now every day, and I watch them walk in and I watch them sit down because they have to wait for a thing, and how they handle that waiting period. It's interesting to be like, that person is anxious as fuck. That person has ADHD because they're all over the place.
Yeah. One thing I noticed, I was at Target one day and this guy parked next to me, and he got out and he touched every door on his car. He touched his trunk. He walked into the store, and then the way he was interacting with customers, I was like, like I could just read. He has rituals.
Yeah. The OCD thing, I didn't realize that OCD itself has its own spectrum of like reasons why for OCD.
Yeah.
Because like Howie Mandel and you actually should watch that one with Rick Glassman on his podcast. The dude with the glasses and the curly hair.
Okay.
Yeah, he did a podcast with Howie Mandel, and they both have OCD. And Rick is on the spectrum. Howie has ADHD, and he really dove in on understanding like ADHD as much as possible.
Yeah.
So they describe these things, and like Howie is describing this thing that he did because of ADHD, and Rick said that actually it lends itself to the OCD thing because you're controlling the situation. So like the certain types of OCD where the reason why they're doing these things in order, or that it's their way of controlling the situation. Because if they don't do these things in this certain order, they just don't have control over the outcome. Yeah. So it's interesting. I never thought about it in that way, that like you're losing power over what feels like your own life and the things that could happen in your life. I always associated it with, it's a tick that you can't really control. So your brain just goes, touch it again, touch it one more time. I didn't know that there was like a genuine reasoning or a rationale for how this is going to help your life. It's going to help your day. It's just fascinating to me.
I've seen things too where people with OCD, they do certain things because the fear of them not doing it may cause harm to family members, or something bad's going to happen if they don't continuously do this, because they don't know what it's like not to keep doing the thing that they've been doing.
I don't know how many individuals you work with that have had OCD, but like, does it seem like OCD is usually associated with a different mental health?
No, I've seen it with anxiety, PTSD.
You know what I mean? Like, is it usually married? Like, does anybody just have OCD? I feel like I'm always hearing it in merriment with something else.
That's a good question. I don't think that, not anyone that I've seen personally. I feel like anxiety comes a lot with that. Because obviously the anxiety of, if I don't do it, something's going to happen. Or like a traumatic experience happens, so then I do this all the time because, that's a good, no. I mean, I haven't worked with tons and tons of people who have like severe OCD. Maybe we, discover it after a person's been with us for a period, and then we see these rituals, and then we're able to identify it. But yeah.
And I mean, that one's interesting, because how do you adjust your survival skills? Like, to them, this is how you survive.
Yeah.
Like, that would be
that's where they do I can't even think of it. My brain's done. The immersive therapy, where they like immerse.
EBT?
EBT, that's like a...
Food stamps?
Yeah. But they immerse like things.
EMDR?
No, that's a rapid movement. That's for PTSD and trauma.
That's what EMDR is?
Yeah. It's not a news station.
There's an acronym for the... We'll be right back with a word from our sponsors.
Immersion? Is that what we're thinking? Oh. Yeah. ERP, not EBT. It's exposure and response prevention.
No.
And CBD, cognitive behavioral therapy, to change the way your brain processes something.
Oh, okay.
I'm not a therapist. I don't do those things.
That's going to drive me nuts. I'm sure whoever's listening has already looked it up and they figured it out, but I'm going to have to look it up after the show, because we've got things to talk about.
Really? We still got things to talk about? Okay.
You don't like me sitting and listening to you?
No, but those dogs keep staring at me.
You can open the door if you want to.
It's fine. I don't need dog therapy.
Speaking of dog therapy, that was something interesting, like kind of a side note for folks. This is just like a fun fact. The oh my God, endorphins. Is that the love juice? Oxytocin. There we go. So finding out that dogs have oxytocin levels and that they match ours was super fascinating.
Yeah.
And so when a dog looks at you, or you make eye contact with a dog that knows you, or you make eye contact with a friendly dog, and don't show your teeth, then it immediately starts to increase its oxytocin levels. Was fascinating. So like when you see their tail wagging, oh, that's what it is. They're winding up their oxytocin levels.
Oh, and then Barley doesn't have any because he has no tail. She's just staring at me.
But that's fascinating. Like, I wonder if there's... So, I wonder if that's why there's animals introduced into the process of helping individuals who are in like rough situations. So like when I was on the adult mental health unit, they had pet day where, they'd bring in a dog or a cat or whatever. And when I was in treatment, there were 2 dogs. What are they? Labradoodles?
Yeah. Golden doodles. Yep.
Golden doodles. There we go. Either way, fun to say. Golden doodle, dolly all day. But the concept that how can you be upset when you see that this animal is visibly happy?
Yeah. You can't be.
Nobody can say mad when you say papi.
No.
Oh, you don't know that movie.
No. Is it from The Matrix?
No, it's from Almost Heroes.
Oh.
There's these guys, these conquistadors that are about to kill Chris Farley and Matthew Perry. And they're going to cut their heads off. And they're like, we'll bring the heads of our enemies to our boss. But he asked if we could get you guys to smile first. He's tired of seeing the sad faces. Could you give us a smile? And they're like, no. And they're like, say papi.
Mm-hmm.
Nobody can smile when they say papi.
Yeah.
And luckily somebody saves them before they have to say puppy. But again, it seems like a lot of people, there's a completely unbiased response from this animal. It doesn't care what you're in there for. No. And so that there's this dog is not, or this animal, whatever, is not judging you. And so you're letting your guard down because they're not going to ask you any questions either or anything like that.
She literally is scooched up to the door. Should I just open it?
Guish in her face?
Yeah.
I can let her in.
Yeah.
Why don't you speak on how dogs helped you during your mental health times?
Well, my dad and my mom, we didn't really have dogs.
You had 2 dogs, you said, that helped you.
Well, I had, hi. Yeah, these dogs are the best. I had some dogs when I was in school, but they didn't last long. They had to go to a real farm, not like the farm.
What, Lily?
Yes, Lily, though. I bought her for myself.
That's what I mean.
Yeah, I love
dogs
Lily.
In your life, not in your growing up, but
Lily.
Yeah.
Yeah. I mean, I had this boyfriend who was kind of a crap face.
Oh man, he sounds terrible.
He was terrible. But she was there for me when he was being a poop head.
Didn't you have another dog after her? Trixie?
Ava? Yeah, we don't talk about Ava.
Eve!
But she did help me a lot. When you were a poop head again.
I know, I suck.
Double poop head. So when you were a poop head, Lily helped. And then when you were a double poop head, Ava was super helpful. I would cry. And
I was a double scoop?
You were just such a poop. You were like the poop after Thanksgiving dinner.
Oh, she's trying to bury into the blanket.
Yeah, she wants to live inside me. But yeah, Ava was there when I cried myself to sleep at night alone. But they have like a unbiased, there's something about
the innocence.
Yeah. Like they just want to be there. They don't need to know what's happening. They just literally want to be there for you. And the dogs were like that when you were gone. They could tell that something was off. And they were just there.
Yeah, so I mean that's interesting to that a human who can have an open dialogue with you and try to do problem solving can be such a turnoff, and your body just doesn't want it at all. But a dog to squish their face is it's just the ultimate.
Yeah.
So it's funny that like, yeah, there's something healing. It like calms that storm in your brain.
Yeah.
Like, watching full grown adults like get down on the ground and crawl.
Yeah. With a dog.
They are able to get you to release a certain part of that that problem, that stress that's getting to you.
Yeah.
It's very interesting.
Animals are very interesting. I'd love to read more about animal therapies and stuff.
Yeah, for sure. I bet
I've got time.
Barley would be a good therapy dog.
You would for sure. He'd just like lick somebody like crazy. I don't know.
Does de-escalation apply to yourself? You know what I mean? Like, when you start to notice that something, like you're getting anxious or you're getting overwhelmed, like are those practices? What's the word I'm looking for?
No, you're right. De-escalation.
It is de-escalation. Okay.
Yeah. Regulate. Yeah.
So I don't know whether to ask about like the self-help stuff or when it comes to kind of relieving yourself of feeling like it's your job to ensure that somebody else's mental health is taken care of.
Well, it's hard because it's literally my job.
I know, but that's your actual job. Friends, family.
I still feel like it's my job. Like I've said this to you. I feel like we all have a purpose, and I know I think of things different than you in the purpose. It took me a long time I knew there are certain things I needed to do while I was here. Like I was sent here for a reason, not necessarily that there was a higher power that was like, you need to go do these things. But each person, like I had to figure out what my purpose is. My purpose is obviously being a wife and a mother, but my entire life, I have been here to serve others in various different areas, as a friend. And then it was like with my parents trying to, help with my mom. And then it was like, then my first job was working in a nursing home. I worked in a nursing home forever. So it was constantly serving others. So I feel like my purpose outside of my actual paid job continues to be to serve others.
I see.
So when I know someone's not doing well with their mental health and I have a background in it, I feel like I have to be there to serve. When we have a friend whose spouse is not doing well in their mental health, I feel like my purpose is to be there to serve and help because I understand it. Not that I know everybody's mental health and I know how to fix everything,
No.
but I just know how to be there and be a listening ear.
So to get kind of dorky, in a lot of, because I've obviously with Justin and other people, well, Alex too, really most of my friends play some type of role-playing game where you need like a navigator, you need muscle, you need somebody who cooks. I don't know. Like they make up these things where like if you're gonna go on a journey, then you need these types of people in your crew. And a healer is one thing that's always needed. And so really it's not that that individual knows exactly what they're going to be doing, but as they go along on their journey, they know that that's what they're going to be doing.
Yeah.
So, and then so the reason why I said that is because like in applying it to what you were saying is it doesn't mean that you know everything, but you know that that's where your trajectory is always going to be aimed towards. It's always the journey that you will be going on.
Forever.
Until you become a cosmetologist and are working at Universal.
No, I really just want to interview psychoanalyze serial killers.
Why do you think you have such a fascination with
serial killers?
Yeah, all that stuff.
gosh, I don't know. I think the older I get too, the darker I get. Like it's such, because I don't understand it.
Were you awake for the dark tourist stuff?
A little bit.
Did you see the Jeffrey Dahmer thing?
No.
Okay, I'll have to show you
But
that.
I want to watch it. Yeah, I don't know. Like, you know, like in the in the documentary about the dogs where they're like their brains light up for this. It's like,
Oh,
when I hear about serial killers, it's like my brain lights up. Like when I figured out, oh my gosh, I can go visit Ted Bundy's VW Beetle in a museum. Like that's all I think about now. I probably think about it at least twice a week. Like the fact that I could get on a plane and go visit this beetle. There's so many horrific things that happen with these people. The freaking clown costumes are there. And it's like, all I think about is like these people, it's because it's...
is that Ed Gein?
Mm-hmm. And it's like, man, I think it's because I grew up watching horror movies and it was like, they're so unrealistic. And then my mom was really, really into unsolved mysteries. Oh my gosh, we'd watch it all the time. So that's when that kind of started cycling.
You're an old lady.
And then my dad works in law enforcement.
Oh, okay.
And so it's just like, it was just like this trickling thing. And it's like, I'm going to be a psychologist and work in the courthouse. Well, then my dad squashed those dreams. So then I was like, I guess I'll work as a mental health nurse and help people. But it's like, I'm so fascinated with a serial killer's brain. I love watching interviews where they talk to people because it's like the way they talk. And I think it's like a part of that antisocial personality disorder. And look it up because it's not what you think it is. Everyone thinks it's like, oh, they're avoidant and all that. It's like, no, the actual diagnosis of antisocial is a lot of what serial killers are.
The weird thing is that why would it be named something like that? Like why does it have that type of like title for something that appears to be, because antisocial.
So socially acceptable, right?
Okay.
So people.
It's a bit of a stretch, but I get it.
I mean, we could look.
I see where it's going.
That's where I think that's, it's socially acceptable to follow the law. Well, antisocial would be going against the law. Just such, yeah.
If anything, they should call it anti-establishment. And
they could.
Because established laws, make antisocial anti-established again.
Yeah. I want to find out the history of why it's, it's
while you're looking that up. So an interesting thing that I heard, so if you haven't seen The Dark Tourist, it's this guy that goes on tours of like messed up or dangerous situations, histories. Like he goes to Fukushima, which is an area that still has very high levels of radiation. He's a part of a tour where they will reenact what it's like to try to go from Mexico to the U.S. border, which is terrifying.
Yeah. So
he does all kinds of crazy stuff. One of the things that he went on was, this Jeffrey Dahmer tour, and like, went to the town and talked to a bunch of people. All that to say, one of the big fans, which is weird to say about a serial killer, but they just know so much about it that, like, I don't know what else to call it. So Jeffrey Dahmer fans is like, one of the reasons why, because when they interviewed him and asked, do you enjoy hurting people? Do you enjoy killing people? And all that stuff, he said no. Like, he doesn't like it, but he didn't want them to leave. So he was actually
abandonment issues.
Yes. So abandonment issues and wildly codependent to the point that they won't be able to leave if I kill them. So like,
and chop them up.
So that was really interesting to learn about him, is like,
yeah, Jeffrey Dahmer is an interesting, they all are, but.
So, they all have to have some level of mental health. This is the interesting
sure.
argument that you and I get into sometimes.
Yeah. I mean, a lot of them have trauma. If you hear their stories.
Yeah.
Some type of trauma occurred in their life. Abandonment, that makes sense.
But like being a bad person to the point of wanting to end people's lives, like I don't think that there is a murderer out there that doesn't have some type of mental health issue, because your goal in life is not to end other people's lives.
Some people are malicious and can just be malicious.
But because we're in a society where that's unacceptable. So a switch flips to where your brain says, no, it's perfectly acceptable. That guy was chewing too loud. So we have to end his life. So I feel like there's mental health stuff that is undiagnosed. Like, why does mental health have to be like something that it's all in books, it's all in classes? Like, there's got to be a wider, I feel like you could diagnose so many more things with new definitions, I feel like. Because there are things that make sense in people's minds that do not to the majority of other people.
Yeah.
And it causes them struggle in conversations with people, in relationships or whatever. But there's no outward anything else. So I don't know. I think about this a lot lately, is to like people who say, I didn't have anxiety until I was older. And it's like, you had it the whole time.
Yeah. It's just more pronounced now.
Yeah.
And you're able to identify it. Like, I had stomach issues when I was younger, and then it's like, oh, it was because he had severe anxiety.
Yeah. Well, and I mean, so the reason why I think about that is like, I feel like if people were able to more objectively have an answer to why they do certain things or why they feel certain ways, it would be easier to tackle that thing. Because rather than being this ominous mystery that you have like, I don't know why I feel this way. I don't know why I think this thing. If you had this little, people hate labels, but once you get a diagnosis, you are in control of that diagnosis thing. Yeah. Well, even if I get that, like, why people say that, but that's yours.
Yeah. It's not. Yeah.
It's nobody else's.
No.
So I feel like that's how people should be looking at it, is like, you're not an alcoholic. I'm an alcoholic. And that's okay. Or you are not my alcoholism. That's what I should have said.
But you're drunk on me all the time.
Well, yeah. But you know what I'm trying to say? Like, and because of that, it's on me to figure out what that means to me.
Yeah.
So if at some point in your life you got diagnosed with a thing, you probably don't hang out with the person that diagnosed you. You don't eat with the person that diagnosed you. You know what I mean? Like, you don't live with that person. You live with you. Mm-hmm. So what does that diagnosis mean to you? And what would make you feel better about having that diagnosis? I hear what you're saying.
And what I can say is that there's not, to be able to diagnose everybody properly, we need more resources in mental health that we don't have. So write to your representatives and say that we need more resources for mental health. We need more funding into mental health, because there are people sitting in ERs waiting for mental health beds that they're not getting because it's just, there's not enough beds out in the world, Mm-hmm. I mean, we go on the whole Britney Spears thing and her conservatorship. It's like, there are people that are misusing the mental health system, or they're not,
Well, I mean, there's 15 beds on the adult mental health unit?
Give or take.
And we know that one in how many people have some type of mental health?
1 in 4. I think it's more like 1 in 3, but 1 in 4, yeah.
And so like the fact that there's only 15 beds.
This is what blows my mind, and I'm going to leave it at this, is that every hospital you go to in the state has a med-surg unit. Every hospital you go to, a majority of them have emergency rooms. There are different levels of traumas that they can take care of. But everywhere you go, there are these certain units. How come every single hospital in the state does not have a mental health unit? Because if you're treating a whole person holistically, a whole person, if their mental health is not well, their physical health is not going to be well. How do you treat one and not the other?
Yeah.
But this is like, are we just going to continue to have the stigma, or is it there's not enough funding in mental health? Do insurance companies not reimburse enough for mental health? Like, what is it? How can we have more resources in mental health, more mental health beds, more, pay mental health providers more money? I don't know if that's a problem. I personally do not know if that's it. But there are just things, it's like, Minnesota, we're known for our great health care. However, they closed a bunch of the state hospitals down where a lot of people could benefit right now. They want to get people back into the community, and I love that idea. There are certain resources where you can get people back in the community, assertive community treatment teams. Mm-hmm. They get people working back in the community, and they work close with these people. However, some people just can't function that way. So, or people are just constantly in and out of the ER, and they're not getting what they need because there's just not resources.
Well, and I mean, I think...
But until one of those representatives have a family member that struggles with mental health and is not getting what they need, then they don't understand how horrible it is.
Well, and to your point about the state-run hospitals getting shut down, the shitty thing is that the majority of the medical world or industry is like they're businesses.
Yeah.
And because unfortunately, everybody kind of has that understanding. They're able to act in ways that a normal business would, which is to say, ERs, med-surg, they have like an SOP. Like a lot of the stuff that comes in, it's handled the same way. Mm-hmm. So they know where they can make money because we only need X amount of things. Whereas with mental health, they're like, anything could walk through that door, and we don't know for sure that we have all of the things that we need to make sure that we can help them. But that's where the problem is where they should be saying, oh, why is it that we don't have everything that we need on this unit? And would things be better? I don't know. I mean,
we can go around about this. It's frustrating. Like, we can even go on the chemical dependency side and be like, okay, why will they pay for someone's first stay of the 28 days, and then after that they just decrease it? Why is the person's 8th stay not as important as their first day on a treatment facility?
Well, yeah, but beyond that, like, are there state-run treatment facilities in Minnesota?
I think there are different like insurance levels. Like, certain places take certain insurances. I don't know a lot about CD treatment facilities. I'm
not aware. I've never heard of like the Minnesota ...
Oh, yeah, no.
Everything seems to be created by a person, or you know what I mean? So like they all just want to get the person out the door, and a lot of them are jaded because, to what you were saying, they see them over and over again, and so what's the use? Even though that same person calls addiction a disease, it goes back to that whole, go mop the floor or go check on room 20. It's the same. Yeah. Eventually it's the same. Yep. Guy's going to come in. He'll be gone for 3 months and then he'll be back. Like, it just shouldn't be thought of that way. And if that's how your job is going, then something needs to change about your job.
They need to
because your fail rate is huge.
Well, that, and they need to have life experience or have a family member go through something that really opens your eyes.
I think that's wildly important. The one person,
I'll be honest, I was a little jaded too about chemical dependency stuff until you went through, and it's like completely opened my eyes. I mean, I wasn't treating people like, oh, this, that.
Yeah, no.
But it's just like you have those thoughts like, oh, when's their rock bottom? You don't know. And then when you have a family member and it's like you potentially could lose them, and it wasn't just you, another family member, it's so scary. It's like, holy crap.
Yeah.
And there's a whole different stigma against chemical dependency because, alcohol is so widely accepted. Oh yeah, my uncle, he's an alcoholic. Like, people make jokes about that shit.
Well, or because it was such a private thing before, like, they would just find out that my uncle went to treatment. He seems fine now.
Yeah.
So, like, there was this concept that, like, you go to sleepaway camp and then you come back and everything's fine.
Yeah.
And so they're just like, oh, so if you go to treatment, it works. But really...
Yeah.
And the majority of those people, it probably wasn't that person's first or second time.
Yeah.
Not necessarily at treatment, but at attempting, because old school people would do the quick cold turkey thing, right?
Yeah.
Statistically speaking, it wasn't their first go round with trying to be sober.
Yeah.
And back to mental health, I met one person who supposedly didn't have a mental health issue.
Well, the dual diagnosis, the mental health chemical dependency. What came first, the chicken or the egg?
Well, yeah. But I'm saying, like, I feel like I'm more convinced that if you have one, you have the other. Yeah. So you had a mental health issue that you were unaware of.
And you were masking it with some type of substance or whatever else, and now it's exasperated because of that substance.
Yep. Yeah, because when I finally stopped, or when I was removed from my my DOC, then all of the stuff... Department of Corrections Services. When I was removed from that, all of the stuff that was able to be buried because of all the dopamine that I was throwing into my system, my body was like, oh, hey, bud, you forgot there's like 3 or 4 things that we got to take care of.
You forgot what anxiety felt like.
Yeah, and so my body just freaked out.
And sleep gets weird.
Oh, yeah. So, I mean, yeah, I obviously, I talk about addiction every single episode, so I apologize. But
I mean, it's important.
I think it. If you think that those two things are exclusive, they are way more related than people realize.
Yeah, I agree. Yeah.
So
I thought we were on the last thought. Now we just made 8 more thoughts.
I know it happened, but we can wrap it up with this.
Take care of yourself. Take care of your loved ones.
Another fun thing that we do on this show is share what meds we're on. What meds are you on?
I'm not on meds.
Oh.
I'm sorry. I'm super sensitive to medications. I can list all the meds I've tried.
See, the interesting thing is when we talked about how anxiety can cause stomach issues, I wonder if your brain goes, a foreign object is in our system. Let's worry about whether it's working or not.
Let's go back to whenever I tried birth control. Every time I tried birth control, I lost my mind.
That's what I'm saying, though. Like, I think the same thing. I think your subconscious goes, we know that there's a thing, and now you know too much.
Yeah. I also think maybe meds would be helpful. I mean, when we were trying to sell our house, I was on hydroxyzine and it helped a lot. And some people make fun of hydroxyzine. It worked really well for me and I like it.
People make fun of hydroxyzine?
Well, I mean, it's essentially like a I mean, because people know about all the benzodiazepines. Like, if I have anxiety, I should be taking Xanax, Ativan, Valium, you know, all these other ones where it's like,
talk about how it's basically Benadryl.
Yeah, a little. I call it souped up Benadryl. It's like, yeah.
But I called it Benadryl first.
Okay. Anyways,
that was my joke.
So you really ask people what meds they're on every episode? Oh. Okay.
Because I'm on Wellbutrin and Lexapro.
You're Wellbutrin, Lexapro, gabapentin,
melatonin, Claritin.
My drug of choice is life.
Oh. You have a Peloton addiction.
I take Peloton.
Ask your doctor if Peloton is right for you today.
Who is your favorite instructor? Is that what people do? Is they just wink at cameras?
First you have to say, where's my camera?
Where's my camera?
Where's my camera? And then you.
No one could see me on that one, though.
There isn't even a camera over there.
I know. I did notice, though, what helps is I get that the release of, you know, that euphoric feeling when I exercise, and that's like, that helps me kind of level a little bit.
Well, it's also a task.
Yeah.
Like to go back to like
my
how.
List.
Yeah.
Yep. Check that off. Plus my butt's getting big and my thighs are getting big. I got to work on that.
I mean, you're telling what thick girl university over here.
That's my shirt though.
Huh?
You thick girl.
I don't know.
You lost your thickness. Get down, gal. You lost your thickness.
Yeah, I can't get down with a thickness anymore. Any other
remember
advice?
Remember we used to podcast all the time?
Yeah.
Okay. Any other advice?
Yeah. You can drop in any time. I would love, I just asked people if they want to do an episode where they can call in and ask questions, and there was a solid response.
Advice. I think I already gave enough advice, didn't I? Be kind to other people. That's like my main advice is you don't know what's going on in somebody's life. You don't know what their struggles are. Why I just want to live in a society where we're just kind. I'm so tired of reading comment sections on Facebook with how hateful and mean people are.
Yeah.
I just want people to be kind. My kids, I just want them to be kind, accept people for who they are and listen to their stories. Sitting and having a conversation with someone, you'll learn so much about them just by listening and hearing their story. And that makes a person feel valued. Oh,
that's a point that I need to start reiterating into the show is validation is huge. Yeah. Validating somebody's feelings, like we were talking about with the dementia or delusions, like validating
how scary that must feel. Yeah. I think I do that a lot too when people are feeling like someone's watching them. That's got to be scary. You just like validating that fear people have. And validating, you know, when you're feeling anxious or overwhelmed, like that's got to be hard. Not that I understand. I think people, you don't know everybody's like.
Yeah. Oh yeah. No. Alex says, I haven't lived it, but I get it. Yeah. Which is a form of saying I would like to validate.
Yeah.
That I empathize with what you're feling.
Yeah.
It doesn't mean that I
know how it feels, but I can empathize. Yeah.
Yeah. So validation is it's a way of letting the other person know that you are taking them seriously.
Yeah.
Or you're taking that situation seriously.
Yeah. Yeah.
Okay. Well, I love you.
I love you.
And thank you for doing this.
Thank you for having me.
Again, I would love to have you back in here anytime you want. If there's ever a guest that you want to come and sit in with. Also, listeners, if you want to ask Kim Duke questions.
I am not a provider, though. Just know that. I know medications, but I don't prescribe meds.
Yeah, I wasn't.
Oh, okay. If you want to ask me a question.
Yeah. Because you can always preface with, I can't diagnose, I can't do XYZ. What I can say is, from what I've learned, from what I,
okay.
I
like it.
generalized advice rather than
Yes.
diagnosis. Okay. Thank you again. And to the listeners, be well to yourselves.